I mean, I know that this is unprecedented because you said costs have never gone down in the history of recording them. I mean, it sounds like if you strip away any politics when it comes to lowering healthcare costs, if you get every major player in the room, hospitals, insurance, perhaps even patients, I mean, what's the likelihood of a solution actually being hammered out? Because I know that sounds great in theory, but do you think that that will actually happen?
Well, I mean, it would take an act of Congress to make it happen, but at some point we're going to get desperate. We want to become, a manufacturing sector. How can we afford to be in a manufacturing sector when every employee has a burden of $15,000 a year, right? How can we do that when the rest of the world's employee burden is $5,000 a year? So we're paying for this. We're paying, most of a lot of our employment is services. We're all paying for this out of our pocket over and over again. And what we have to do is just find a way where we can make it a national priority and everyone puts their shoulder to the wheel. The one thing I saw that gives me hope on this was after the Affordable Care Act came out, there was a lot of talk about reducing costs. And for about 3 years, between 2010 and 2013, we almost went flat, right? Which was the first time. And then everybody we all backed away from it, right? And said, oh, well, we've got to do this, we've got to do that. And so people just stopped trying. Well, I saw when people really put energy into it, there was a flattening of the curve. But we've got to get the incentives right. For example, I mean, everybody benefits in the ecosystem today when prices go up, right? So everyone makes more money when healthcare costs go up, and that's what we have to change. Even the insurance companies, we've capped them at 15% profits, right? So if we achieve our goals, we could drop that cap. We don't care how much money they make if we all reduce the cost of care. But right now, if you've got a 15% cap on your profit and you're an insurance company, the only way you can make more money is for the premium to go up, right? So we're incentivizing the insurance companies to raise premium and to not bring it down. And so that's really where we are today. And today Medicare is like the most profitable insurance plan in the United States. I mean, are you kidding me? I mean, where any other sector, it's the least profitable sector. Right. So what's happening here? It's the incentives. We're capitalists. We have to design a program that works within the capitalist framework and that also cares about the social good.